presentation. And I want to welcome everybody. Welcome to the COVID aftermath, how AI is helping get patients back into right care setting, offset the impact of deferred care, and reduce financial loss. And I am with our partner Javion today, and we're going to have some introductions shortly. But before we do, as I'm broadcasting from the bottom of the Caribbean here, as you can tell from my background, we are going to go ahead and go through a couple of the level setting and how to interact with the slides. And I'll be looking over there if you see me looking away. So first of all, this event is brought to you by the Microsoft Healthcare and Life Sciences Group. You can always visit us and see myself and all of my colleagues and content that we're posting, as well as upcoming events at aka.ms/HLS blog. That's aka.ms/HLS blog. Be sure to check there. We will have the recording from today's session available for on demand, as well as follow-up content there as well. A couple of housekeeping items before we get started. So first of all, we encourage you to ask questions. So ask. We love to hear from you. Just understand that all questions are moderated. So what that means is our moderators will see the questions before they appear to everybody. Sometimes we'll ask for clarification and stuff before we publish it, but you can go ahead and fire those away. We love to hear from you. We want to answer them. And our guest, Angela, has let me know that she wants to hear from you during the broadcast. So you don't have to hold those till the end. Also, if you're of a mind, we love to know who you are and where you're from. You may not want to share your whole name, but you could, certainly say your first name and where you're from. To date, the furthest attendees we had 2 nurses one time from St. Petersburg tuned in. If you can beat St. Petersburg, you should let us know, and let us know anyways. Finally, at the conclusion of this webcast, just as I mentioned previously, this recording will be on our blog site at aka.ms/HLS blog. One last time, aka.ms/HLS blog. And we will have the slides that will be presented, as well as our other content. So real quickly, to ask questions, to post things, comments, etc. If you are not seeing on the right side of your screen, or if you're on mobile like me on my phone, I oftentimes tune in. It's not even showing. There we go. The background will put my head out. If you're on a mobile device, you'll want to click. You'll see this little dialog box with the question mark. That will provide you the dialog box to go ahead, post and ask questions. Once you have that, as you can see, you can post your question. You can put your name. It's optional. And you can also, after you ask, you say post as anonymous, which will ensure your anonymity, right? So feel free to do so. We just would love to hear from you either which way. That's it from me. I'm going to go in the background, drop off the screen here, and without further ado, I would like to welcome Angela Adams from our partner Javion. And Angela, feel free to take it away.
Okay. Hello, everyone. Thank you for having me today, and thank you to Microsoft. This is always exciting to get to speak to new people, new friends. I wanted to start on video just to say hello to everybody, make this very personal, and I will say exactly what Mike just said. Please make this interactive. It makes it more fun. Love to get a discussion going. Love to hear your thoughts. So feel free to ping in questions and we'll try to get to them as quickly as we can. So I'm going to switch off my video at this point and switch over to sharing my screen.
And we got the video off, just waiting for the screen.
How does that look?
We are still seeing my screen.
Oh, hold on just a second.
Let me unshare mine.
Try this again. How's that?
There we go. Beautiful.
Okay, perfect. I think we just had an overlay there. So today what we wanted to address is really what we've been in deep conversations with our customer base in healthcare for months now. And if you look at Javion's client base and Microsoft's client base, we've spoken to, I don't know, between 16 and 20 different clients or health systems around what are their greatest needs right now? What can AI help to solve for them? How can we use a decade of experience in AI and a really data-rich environment of 30 plus million lives to help answer the evolving needs and questions today? So where we're going to focus is really this COVID aftermath, how AI can help get patients back to the right care setting, offset the impact of deferred care, and reduce financial loss. Much of the presentation is going to focus on a solution called uncompensated care and defining what that is for the group. So I'll go ahead and jump right in. For those of you who don't know me, which is probably most of you, I'm the National VP of Growth and Enablement at Javion. My role primarily is to bridge the gap. My background is all nursing, and it's bridging the gap between understanding AI, its clinical applications, workflows, and how we can get healthcare adopting AI to help improve patient outcomes and financial outcomes in an environment where we really very critically need both. So you can see my background. It's kind of cool how I went from being a bedside nurse. I started at Duke Health in Durham, North Carolina, loved the ICU and had the opportunity to go to medical legal. I learned a lot in that industry, did both plaintiff and defense, wrongful death, malpractice, med device cases, med technology cases, and was really able to put the puzzle pieces together. It's kind of cool when you get I don't know, sometimes 1,000-page record in your lap and you have to piece together, could this outcome have been changed? Was there anything that went wrong that could have been impacted? So loved my time doing that. That led me to an opportunity in quality outcome improvement, where I worked in the medical device industry as a clinician and taught people how to prevent med device related injury. Then I went into sales for healthcare. And then Javion actually kind of found me. We found each other. I remember my very first HIMSS event, and I was overwhelmed. It was in Vegas, and I was tasked with going to find a strategic partner that could take all of this thousands and thousands and thousands and thousands of med device data elements that we had and make it into something value add where we could predict which patients were going to have negative outcomes from the devices so that the hospitals could have that information in advance and help to identify and choose the right patient. And that's how I was introduced to Javion. I was very intrigued by Javion as a clinician to just understand for the first time, wow, much of what we deal with every single day, that's our biggest challenges in healthcare, is predictable, and not just predictable, but preventable. If we could just know in time to make an action or create an action to do so. So it was a turning point for me. And I've always been a clinician that was focused on helping patients. And instead of helping individual patients, I was able to then move to Javion, where I can help hundreds of thousands of patients by the outcomes that we predict and prevent every day for our health system. So that's a little bit about me. I loved this meme that I saw the other day. I don't know about you, but I miss precedented times. I feel like 2020, and this is how our health systems feel in all of our interviews, they feel very much like they don't know what's coming next, what to do, where to put their focus. And it's because we are in very unprecedented times. And if you look at 2020 health landscape, I think it has evolved by the month, really. And Javion, I put a little timeline of just how we've felt it from our client base and how we've had to evolve to meet the needs month to month. But if you look at this, it kind of starts in March and goes through today. At first in March, our health systems were very much, Javion, we don't understand what's going to hit us, but we think it's going to be big. We don't have any patients right now necessarily, but how can you help protect us? How can you help protect our patients? So we quickly pivoted, and actually Microsoft helped us quite substantially. So very thankful for the partnership there. But Microsoft and Javion were able to put up, if you click on that link on the bottom of my slide there, the covid19.javion.com, we gave a free national map that got national attention from the COVID task force and Johns Hopkins and others, where we could actually predict by individual community all the way down to census block level who was likely to deteriorate the quickest if they contracted COVID. So what hospitals and systems were able to do is take these maps, and we made them into individual patient maps for our clients, and they could do proactive outreach. And we had customers like Grady in Atlanta. They had med students doing outreach to critically, vulnerable patients and doing education, training. There was so much confusion in the media. Nobody really knew what to do, but they wanted to keep at least these most vulnerable patients with good information coming from their health system that they trusted. They were able to set up a lot of their chronic care management, vulnerability patients on programs to get mail order delivery. It's been some really cool projects to watch people work through. But then we kind of moved into April, May, June, where COVID started hitting our hospitals hard. We support Northwell, and they really got hit as one of the hardest health systems up in New York. So turning to us, people like Sentara, University Hospitals, Northwell, turning to us to be like, hey, help us. Like, we have people coming in our ER. We need to understand what level of care, what's their likelihood to deteriorate towards mortality, what's their respiratory distress risk, and help us understand how to better care for these patients. So Javion created Javion Triage. Then you move on to August, September. The message from all of our C-suites was, hey, we furloughed staff, we didn't have the volumes that we thought we were going to have, but now we need everybody back, and we need to recover these volumes, both on the patient side, the surgical side. So Javion created, and this was actually a very innovative, first time ever, an AI honed assessment that you could take really quickly online that pinged back to Javion's environment and told you what your return to work status could be and what vulnerabilities you had towards deterioration if you contracted COVID. And then, of course, the last thing that we're going to focus on today is help us get volume and financial recovery. It's the message from every health system that we cover. We did interviews with several health systems that are not even our clients, and the message is the same. We need help. We need creative and innovative ways to bring top line revenue back, and we need to do this fast. So that's where we're going to focus the presentation for today. So if you look at this roadmap, it really was born out of these months of conversations of understanding what are the hospitals struggling with the most. So Javion created a financial recovery suite around the AI that we have an expertise in for over a decade. So people are like, well, is this brand new stuff that you're building, or how are you able to pivot this quickly? And can we trust these models? Can we trust this performance? Well, the answer is yes, because this isn't different from what we've been predicting over the past decade with our Javion core environment. In fact, optimizing utilization has always been probably our highest selling product line. Now, if you look at what the goals were around it, those have changed quite substantially with the 2020 COVID aftermath landscape. So if you look to the left side, avoidable utilization was where it was at. Everyone wanted Javion to, hey, predict in my population who's going to have, let's say, an avoidable admission or an ER visit in the next X time period, whether it be 30 days, 90 days, and tell us if it's modifiable and if we can do something with care coordination or chronic management teams to change that trajectory of risk and actually get this person to a lower level or lower cost of care, but still improve their health outcome. So that's been probably the most successful over the past 5 years selling solution from Javion is avoidable utilization. Well, you can imagine in 2020, it really still avoidable utilization is very popular and of course very necessary for managed risk populations, ACOs, IDNs, Medicare, Medicare Advantage, health plans, employee-sponsored health plans. But deferred care targets have really become, hey, help us understand who really needs to be utilizing our system, who has symptomology, who has chronic disease state deterioration that we can proactively outreach to get them back into the health system that needs care now. We know that a lot of patients are staying home, they're fearful, they might have increasing symptoms of disease states, they're not going for preventative screens. And so it's going to have a massive toll on the healthcare industry and the health of our communities and population in the United States. So deferred care is going to be a big focus for health systems and getting to those target audiences. Disease state early detection, one thing that we heard loud and clear from our client base was, hey, we need to get these service lines back that had a lot of prevention and screens, and it really led to the volume for the rest of the year. But also what it provided at a patient level was we were catching things a lot earlier, and the diagnosis and the acuity of illness was such that it was preventable, it was still treatable. Whereas right now, what we're seeing is people coming in very late stage, very complex cases coming into the hospital, much more cost, much more length of stay, and deteriorating outcomes. So how can you get disease state early detection on things like cancers, oncology, cardiopulmonary illness, heart attacks? All of that is stuff that Javion has worked on for years and will become a focus point of 2020 and 2021. And then of course the bottom, uncompensated, uninsured care. I think a lot of people roll their eyes when I get to this one and they're like, yeah, age-old problem, age-old solutions. We've got 19 vendors working on this, but we found a very proactive way, innovative way, completely new way, really, to attack that uncompensated, uninsured care. And in an environment where it's worsening by the day, really being able to provide something to hospital strategies to improve top-line revenue back to their bottom lines, which is really what everyone's looking for. So I found this article on RevCycle Intelligence or RevCycle.com, and it was talking, this was just 2 weeks ago, and it really mimicked what our hospitals and health systems were saying to us, which is hospital execs, they know that their uninsured population has increased as unemployment rates have increased. They have an increase in self-pay, Medicaid. They've got high expenses, low volumes. Their margins are terrible from year over year. And so really this is where we need to help them and get that volume and financial recovery back. In fact, we did a summary slide, and this is it, of everything that our health systems were saying to us. So if uncompensated care was bad last year, what does it look like in our current COVID aftermath? And everything is worse. So I know the New York Times ended up calling the hospitals like insurers of last resort. And then they also tagged the line portrait of devastation for the unemployment rates that will lead to a phenomenal amount or increase of uninsured rates, kind of riding that raise. Decreasing dish payments, so those disproportionate share payments that hospitals have become very dependent on are set to decrease. And of course, our election landscape is still undecided. So no matter who gets into office, they're still thinking, well, we need to not plan on these because they've covered up to 50% of our losses in the past, but even in the current Affordable Care Act projections, they're supposedly going away. We'll see what the current political landscape has. And then the toll of deferred care. We talked about the more complex patient, the more costly patient coming, the higher levels of acuity. And they're worried that some of these uninsured patients that last year may have only cost them between $11,000 to $25,000. They're coming in with so much more complexities and acuities in this deferred care environment that these hospital stays are costing well over $100,000 per stay. financial recovery for hospital margins, and then really once they think through everything that they've done over the past decade around uncompensated care, it is a place ready for disruption. There's been not a lot of innovation in that space. It tends to market itself around very reactive. Okay, the patient is in a bed. Let's run a tool that tells me that this patient's uninsured and they're likely to be eligible for this government program or this insurance type. I'm going to go put financial services or one of my vendors all over that, or I'm going to try to chase them after the fact. It's very reactive in its approach. So helping hospitals get proactive with this by using an AI environment and getting ahead of this curve and being able to stave off some of these additional losses that they're expecting and turn it into revenue is really quite phenomenal. And it's gone well in conversations. We also want to address, because this is very patient focused. Honestly, I think everyone on this call, it's pretty obvious that an insured patient or a covered patient is a healthier patient, and all research points to that. They have increased access to care, increased prevention, medicine screening, better managed chronic conditions. They have financial security that doesn't come with having $100,000 in medical bills that are coming to your house. And then increased utilization of services really across both ambulatory and inpatient to give you a much better structure for the health of somebody long term. So the proactive versus reactive really has been where we've heard the message loud and clear. If you look at vendors today, they're charging hospitals a phenomenal amount of money to go chase money, chase bad debt. Well, Javion thought, isn't there a way before the patient even gets to the hospital that you could predict, well, this patient is going to have or is rising risk for an event within the next X time period. It's going to be very costly. Put them into cost buckets and then try to attack risk in a very targeted, identified way where you have time to enroll the patient. I mean, think about it. You're lying in a hospital bed, feeling awful. Maybe you just had a heart attack, and financial services is standing next to you saying, hey, will you fill out all this paperwork so that we can get you enrolled? Obviously, it's not the optimal place for you to talk about healthcare and insurance options. So getting in advance of this and having people look kindly on their hospital systems that care enough to offer this service has been the message out there to the marketplace. So what is it? Honestly, it builds on that decade of experience that Javion has in predicting utilization and cost patterns, which patients are going to have an inpatient stay, which patients are going to have an ER visit, placing them into cost buckets, and doing it far enough out, 6 months out, so that you can take an action and have a successful outcome like enrollment to a covered plan. So Javion put together a turnkey solution where we take your data, we identify which patients, we layer that with intelligence from their consumer profile to understand what's the best method of communication to do outreach. Then we send it to automated outreach vendor that has been phenomenal. I'll show a slide in a second about what they do, where they engage the patient either voice or text, interested to get human-to-human interaction, to get on the phone with a certified insurance broker that can talk through their options, look for government programs that they may have eligibility to, and even other insurance options or local community or statewide initiatives that can help them get better access to care and help them get covered care. This tends to be one of the questions that comes up a lot. So I put a slide in here, and what just happened? Hold on one second. Just stopped sharing for a sec.
Oh.
Am I back?
You are back. Yes, you are.
Okay, good.
And then let me know. We also had a couple of questions that have come in, but Whenever you're ready.
Oh, nice. Well, I would love the interruption. I think it's great to break this up. So let me know. Go ahead and shoot.
Yeah. So there was, let's see, one was about where will the slides be posted, and I answered them in line. Again, it's aka.ms/HLS blog, and they asked if the link that you provided, I think it was earlier, if that was going to be made available. I said yes, it would be with the slides, and they'll be presented. But then we had a question: is the AI that you are talking about in the cloud, or is it software that you install on premise?
Great question. It is a cloud-based solution. We are hosted on Microsoft Azure, and we have proposed on-premise solutions in the past, but all of them were not cost-effective, so most people chose the cloud-based solution. So all of our solutions today are cloud-based.
Awesome. Okay. And the second one that we had, they might have asked a little early. I think you're going to be getting to this, but it asks, this seems like it builds on efforts we have started as a result of COVID. We are using Teams now for telemedicine. Will this integrate with it, and how?
I think we may answer that question, so let me hold that, and then
Sure. Yep.
Michael, if you feel like I haven't answered it, let's bring it back around in the end. If we can do it that way, I would rather show the graphic with it so that
Yep.
people can see, and it might answer that question.
Awesome. And that was it. The other, we just had a comment, or two people commented, yes, they miss precedented times, and me too.
Yes, I actually want to get that mug. So Lacey, my marketing lady, said she's going to get me one.
There you go.
Because we certainly do. But interesting point there. We were on the phone with one of our health systems just last week and kind of joking about that. And he said, well, isn't this the best time to have an AI partner by your side? And I kind of laughed and I said, well, yeah, I can think of a lot of reasons, but what's yours? And he said, well, a lot of our traditional analytics tools are struggling because traditional analytics are based on precedented times, not unprecedented times. It has to have a historical and a precedent set to recognize trends and patterns and guide us. So he said, I'm thankful that we've had Javion through all of this because Javion is able to be agile enough in the AI environment to be able to answer questions that we've never seen. And the example that I can give around that is when COVID hit, people said, well, how can Javion, like the US government doesn't even have outcomes data on COVID? Well, what we found was we had tons of data on other respiratory illnesses, flu, H1N1, all of these very typical respiratory driven viruses. So we could use surrogate targets and parallels in all of our data until we could fill the gaps with COVID outcomes data. So we had kind of an ongoing evolution of being able to start placing COVID outcomes over our surrogates. But in the meantime, we were able to get really, really good predictions and an interaction and interventions and changing of outcomes with just using surrogates in the background in the AI. So kind of a cool thing to just mention there. But
yeah, I was going to say that to me, that's fascinating because you're able to extrapolate out based upon similar patterns you've seen in other illnesses, and then be able to kind of iterate with the real data as it comes in and further refine what you're getting out of it.
Yeah, and we got to work with the COVID task force and John Hopkins. That was some fun projects that we got to work on. Terrible time, and but very, very neat stuff from an AI perspective on what we got to achieve. So I just wanted to show this because I think it validates in everybody's mind, like, okay, well, one of the first questions we would get is, well, why can't we just do this ourselves? We know who our no payer uninsured population. Why can't we just go out proactively and target them? I mean, the reason is pretty clear on this slide. It doesn't make financial sense unless you are very acutely targeting using something like AI to get to that needle in the haystack. So when we ran an analysis on a few populations, what we found were, this one was a direct one of our clients, and their very high risk group, and this was using Javion's high cost utilization, so the uncompensated care solution, overlaying that. They're very high risk folks for the next 6 months of utilization that were currently uninsured was about 19.5 times the average cost of their low risk. And if you look at what that very high risk or high risk patient is going to cost them versus what their very low patient is going to cost them, and the majority, 70% of their uninsured fell into that category where they were not going to utilize, they were not going to be a high cost utilization or outlier. So knowing which patients and then being able to overlay that with rules-based, like who's likely eligible for government programs, or who has income levels that could support even marketplace insurance if they knew their options, that became a very interesting place to start. So if you look at the ROI or the return on this, 5 AI targeted from that group up there at the high risk and very high risk was equivalent, getting those 5 was equivalent in the same cost of getting 100 random enrollments. And you can imagine the amount of time spent trying to get 100 enrollments and how many you would need to get on the phone to get that type of success rate. You're talking about reaching out to thousands of patients to get that 100, whereas Javion's going to have you reaching out to hundreds to thousands to reach that 5, but that 5 is going to be super impactful to your bottom line and delivering top line revenue versus cost. And I've got an example coming up that kind of shows that. So I wanted to just give a quick, here's how it works in a visual. So the hospital system, if they're a current client, they're probably sending us a lot of this data. If they're not a current client, we'll set up the data feeds between us, but basically claims and billing data will come to Javion with a registry of who are your active patients that are currently no payer or uninsured. We will use that to run through the Javion Core cloud environment. We'll do all of our predictions for who's going to utilize the system, be an expensive utilizer in the system in the next 6 months. We'll then do an overlay on best methodology by individual to do communication and outreach. We'll send that directly to our automated outreach vendor who will do all of their, and we'll talk more about this in just 2 slides, but hey, hospital ABC cares about your health. We want you to know that there's options out there for coverage for you and your family. Do you have time to discuss now? Would you like to schedule a time? And then sending that directly to human interaction. So it becomes a very turnkey solution for hospitals, rather than putting the burden back on any of their resources internal in their financial departments. So Drips is the partner that we've chosen to do all of the automated outreach. And the reason that we chose them was they had phenomenal success across really about 10 different industries with engaging people at their level, coming up with conversational AI to reach you by SMS, speaking the language, the slang, the whatever way that you want to text back and forth with somebody, and then also being able to offer that in a voice service as well. They have a white paper on their website that talks through, they engage their audience 25,000 times more effectively than outbound calling or SMS blasting. So we looked at a lot of vendors that they just didn't have a good, successful outreach approach. You had to reach out to thousands and thousands just to get, a few that engaged. And we wanted something that was very impactful and that met the patient where they were, because this is a very important, intimate thing that you're talking about. You're talking about their health, their wellness, their families, their financials. And so we wanted it to be the right partner. On this slide, it kind of shows you how it would work. And it looks like, hey, Ryan, it's Jamie. we have options, and basically we're white labeling the hospital there with saying, this is the health system reaching out to you, and then scheduling a time that works for them. This can happen over days, weeks, months. The conversation can continue until they engage that patient and get them enrolled or to an insurance broker, whatever the need is. So pretty cool technology, and we're excited for the partnership with Drips. Most people want to know, well, what's my opportunity? Where's my hard dollars? So I just took one of our recent examples of an opportunity analysis that we ran for a current client that's interested in this solution. And I thought it was a good one because it's a mid-range hospital system. They're an IDN. They're also part of an ACO. They have about, I think, 600 or 700 beds total. They didn't have a huge degree of uncompensated care costs when you look across the nation. We've talked to Memorial Hermann and Duke Health and even Henry Ford. They've got hundreds and hundreds of millions of dollars tied up in uncompensated care. But here they had about 26 million of uncompensated care cost, not charges, but cost. And in their population, they had about 50,000 patients that were non-payer, uninsured. So out of that population, Javion was able to identify, they just wanted to know Medicaid alone. They didn't really want to look at other insurance options at this point, although it will be part of their targets for their global solution. They just wanted to understand their opportunity just in Medicaid alone. So out of that 50,000, there was about 5.5% that were not only likely to be a high utilizer, high cost in the next 6 months, but also had likely eligibility towards Medicaid. And so if you look at that, what that was costing them was about $2 million in cost, about $5.6 million in charges for uncompensated care that would have hit their system. Then you take Javion and you try to flip that, and you try to engage with those patients, get them enrollment well in advance of their utilization events, and you've got a potential gained Medicaid revenue instead of a loss of 1.7 million in 6 months. That's pretty phenomenal for a health system that's operating on zero margins right now and needs every dollar back to top line that they can get. They're struggling with volumes, they're struggling with surgical recovery, and they look at this opportunity and they say, yeah, if we can do this and we can add this to our uncompensated care strategy and be proactive, let's do it. So what I wanted to offer to the group here today, if you have customers and you're on the Microsoft side, or you're a hospital or a health system on the call today, and you would like Javion to do some draft opportunity analysis and have a discovery session with your team, just to point out, let's see where the value lies. Does this make sense to add to your strategy? And should we explore this further with RevCycle? You can reach out to me directly at angela.adams@javion.com. I've got that there in the presentation. And we can run that analysis for you, do a quick 30-minute discovery session, and you can pretty much figure out quickly whether or not this would be advantageous for your system. So I'll stop there.
Yeah, I was going to say, we have some questions that have come in, if that's okay.
Absolutely.
So number one, let's see, the idea of surrogates is interesting when thinking about possible future outbreaks. What was the level of difficulty in assigning surrogates?
Well, if you ask me, it was extremely complicated. But if you ask our data science team, I'm sure they're used to doing it every day. So I'm sure it's not something that's super complicated for them. But for me, in my nursing background, I think it was extremely complex. But we use surrogates all the time when we don't necessarily have the direct match to the target. And then we can, in the future, get the direct match to the target. But it's a way to use the agility and the flexibility of AI.
Gotcha. So that's something that then the teams, they're familiar with doing.
Oh, 100%.
Okay, great. Also, we had when the core identifies communications channels. Is this then moderated or automated?
It's automated. So what we do is we send it in flags through a webhook API to our automated outreach vendor drips, and it helps them understand when to do their outreach, how to do their outreach, language to do their outreach in, so that they can be more effective in their outreach. Drips has their own AI running in the background, but they were excited that Javion was going to be sending flags to just even make engagement and outreach and communication channels more effective. So we offered this to our payer and insurer marketplace. And that's where most of the times we call it activation or enrollment. But that's most of the times where we're using channel preference, channel management. But in this one, it makes a lot of sense to offer those flags, send it across automated to drips, let them automate their process on their end for when these go out. Some of them, they don't go out until 7 p.m. because that's likely when the person is most likely to respond. Some of them go out in the morning, email versus phone versus text. All of those come in through thousands of data elements that Javion consumes on the social determinants of health and consumer profiles that we purchase and then basically build into data science AI algorithms to help us predict on an individual level where they match mathematically what would be the best type of outreach and preference to get the best outcome.
Awesome. The last one really pertains to drips, but it says, so in drips, it acts like a bot. I think they're referring to, you were showing the animated GIF screen that was showing a conversation.
Yes, it does act like a bot because it is a bot, except it looks very human-like. So the whole goal of drips was to create a human-like interaction and not have to write a bunch of rules behind the scenes and then have it be very confused when somebody didn't use a certain, press yes or press no or hit this bit.ly link, or they wanted it to be very conversational and they wanted it to feel like a human-like interaction, which is why that was their huge differentiator and their competitive advantage to Javion as we were looking through lots of vendors in this space. Was how can we get to a human-like interaction that doesn't feel like you're talking to a bot, but is able to automate it to the degree where you're talking cents on a dollar for outreach versus human to human, which was upwards of $26 per interaction.
Awesome. So earlier we had a question, and I guess you and I could explore the one about teams. And I saw, could you pull up, I guess, the maybe we can figure it out from that with the diagram you had showing how it gets ingested information. Yeah, I think this is it, the solution workflow. So, from our the customers of ours who we worked with, like during this was referring to COVID, a number of customers we worked with started using Teams as a part of telemedicine for triaging, et cetera. And I guess what their question is, let's see, we're using Teams, will this integrate with it and how? So this really is a separate, like you had mentioned, this is an Azure-based service, cloud service. Does it have though, what is the interface from somebody within the healthcare setting versus the patient? What would that what would that look like to them?
Yeah, that's a great question. So in our exploratory conversations leading to this design of the solution, what we realized really quickly was no one had any resources to put to this. And if we sent them the information, even if we sent it into their EHR or something like Teams, they really didn't have the staff to pull off any of the outreach. They didn't have partnerships with automated outreach vendors. And so they very much were like, well, if Javion can't do it all and this doesn't become turnkey, then there's really no capability on our side to be able to do this. So I think what our feed will eventually be for hospitals is really just analytics dashboards so that somebody from RevCycle can go in and say, oh, here's a
The
dashboard
reporting.
that shows me, yeah, it's like a reporting dashboard. Here's how many patients are predicted. Here's how many JVIONs enrolled. Here's how many are still being outreached. Here's the success of the outreach campaigns. You know, here's who's dropping off. Here's who's opted out. All of those types of analytics will be coming across, but I could see that in some type of I just blanked on Microsoft's
Like Power BI?
Power BI. I just blanked on my my big catcher there, but yeah, I could see that going into something like Power BI so that RevCycle can check in with us. But really, we don't want any of this information having to be funneled towards the hospital to create action.
Sure. I guess from my end, a follow-up question: if they're able to do some of that reporting, I'm trying to just kind of figure out what they're talking about from their question, but within, like, if they're going to be doing a telemedicine, if there was some type of outreach and stuff, that's really around the feeding and the setting things up and contacting them. I guess that would be like a patient, you know, historical data or contact. If that makes sense.
Kind of.
Well, because, you know, I'm looking here, it says target population, best means of communication to improve engagement. So you're contacting individuals, right?
Mm-hmm.
And if those individuals are being contacted, and then there's a subsequent session that has been set up with them, something where there's, you know, an actual patient doctor outreach. I guess that would be part of, if you did some type of a dashboard, then that they might be able to access that information that they've been reached out to. Or
I think so. I just don't know why it would be necessary in this workflow.
Okay. All right. No, that's fair enough. I'm just trying to figure out what they're trying to get to. So the last question I got was, so we just contact Angela via email, and I typed yes.
Yeah, that's perfect. I put my email in the presentation that I know will be posted, and then I don't know if there's a better way to get my email address out there, but just let me know and we'll do it.
Awesome, and we'll put a direct link in with that. I'm not seeing any other questions coming in. There was a couple of things that, you know, I just had some questions about, but, you know, one of them was, you know, the customers that I'm working with, one of the things that we are seeing is that they are very resource constrained right now. And as we look at that, and we look at, as they're trying, you know, they're already kind of, they struggled with the whole COVID, you know, having to bring online new tech, you know, real quickly, et cetera. Is this another big, you know, really a big lift and shift kind of venture for them? That it's going to take a lot of effort. What does that look like from their end, the effort to be able to you know, work with a JVION and get on board?
Great question. I think that that is why we tried to design this with as minimal amount of resources from the hospital end. I'm not going to say that it's without any resource necessity, because they are going to have to set up data feeds to JVION. Obviously, if they're a current client of JVION, it's going to be a lot lighter of a lift, because likely we're receiving a lot of the data feeds and there will just be a few others. But if you're a new client to JVION, you are going to have to set up data feeds towards JVION. But the type of feeds that we need typically are already interfaced to go outbound, 835s, 837, billing claims, a do not contact list, so that we make sure that we are abiding by those that ask not to be contacted by the health system, and a few other data feeds. But it shouldn't be, I mean, when you look at other JVION solutions, this is like a fourth of what we typically would require to run a solution through Javion, and we did it that way purposefully. We used the value of the enriched data environment that we have today, and we said, what's the minimal amount that we need to be able to pull off a very accurate prediction for this, and that's why the lift became what it is today. But I'm hoping that because it doesn't take any resources from financial services, and you don't have to have an integrated build per se, and Javion's taking care of all that back-end automation from identification all the way through enrollment, that hospital systems would feel like, well, it's a really large return with very little cost to me having to resource it.
Gotcha. No, that's excellent. I just got another question had popped in. It said, this has been great. Thank you. We'll be speaking with my colleagues. Are there resources we can look at? So I guess the question would be, is there any other resources you could point them to besides what we're going to provide at the close of this?
This is probably the best, most up-to-date resource that you can look at. I believe we have a landing page for the Financial Recovery Suite on javion.com, and more to come in, I'm sure, some blog and webcast series, but this is probably the most up-to-date. We have a 2-pager that if you reach out to me via email, it's kind of a nice little marketing slick on understanding quickly. If you wanted to give it to some of your hospital executives to see what the interest was, it explains it pretty clearly in just 2 pages.
Excellent. You know, one of the things that, you know, I've seen with Javion, you've always focused really with the clinical AI on harm prevention. Is this so it would seem is this really a pivot for you, or just a repurposing, or?
Yeah, that's interesting that you bring that up. We have focused on patient level, always putting the patient first, quality, clinical AI. If you look at our solutions on our website, it's all around preventing harm, improving outcomes. But honestly, we feel like this aligns very much with our mission, because if you look at all of the improved care that can happen with a patient that is covered versus not covered for insurance, it improves so many of their health outcomes, and they get preventative medicine and they get free screens, and they start interacting with the health system and they have better access to care. So Javion does feel like, hey, not only does this build off of a decade of experience of what we know best and our expertise in predicting things like utilization and cost, but it also allows us to still help the patient health clinical outcomes. Now, huge advantage to the hospital that it's also helping their bottom line and helping them to gain some top line revenue growth. But sometimes I think those are the perfect solutions, the ones that are very altruistic and going towards helping patients and helping our communities become healthier, and then also helping financially at the hospital level for us to continue to give good care.
Excellent. And I guess finally, my question to you is, when we look at this whole area, because I handle both providers as well as the folks. I handle a whole range of them. But when we look at this uncompensated care, right? There's a ton of people out there working in this space. Is there any kind of, I think it's self-evident from what you presented, but is there any kind of differentiation that you provide as opposed to other ones out there in the field?
A great point. In fact, I got rather discouraged early on. This was months ago. Every conversation I would get in with my current client base, they would be like, yeah, Angela, I mean, we already have like 18 vendors that do this. And, when I started the conversation, it was almost like they were closing the door before I could even get to the punchline. And so we realized that this is a saturated space, but it's all reactive. So if you can get the health system and the folks that you're talking to understand, like, hey, you've got all these strategies, and they're good strategies, and they bring back a lot. But even after all those strategies, how many millions of dollars do you still have in uncompensated care? And when they think about it that way, they're like, yeah, even though we think we're real good at this, we still have, 150 million in uncompensated care costs after all of our vendors and strategies take place. So once you can get your head wrapped around that and say, there still is opportunity, and what if we attack this proactively instead of reactively? Could you add another piece to your uncompensated care strategy that could get you some top line revenue gain? And almost everybody's answer has been yes.
Yeah, I was going to say, when you can start doing that proactively, and with finances being as they are, anything that's going to give you help you along that line is going to be something that I think people are going to be interested in. Other than that, we've gotten a number of thank yous. Thank you. Thanks. Great presentation. So I don't have any further questions. Anything further from you?
No, this was really fun. Thanks for having me on. And thanks to the group for giving the interactive questions. I think it makes it really impactful. And looking forward to some of you reaching out.
Yeah, this has been great. And just as, last reminder, if you type in aka.ms/HLS blog, that is going to bring you to this site here. And this is where we will post the recording. It will probably be first thing in the morning up tomorrow, just because I have meetings the rest of the day. But you can see here, this is where we post. So here's that presentation from today. We have an upcoming one next weekend and next week. But please stay tuned. Check out what we have to offer and tune in. But I'd like to thank Angela and Javion for today's presentation. I think it's been excellent, Angela.
Thank you so much.
I hope you hear from some of these folks soon.
Yeah, absolutely. Thank you. Have a great afternoon.
Have a great day, everybody. Bye-bye now.